Hi, I am Dr. Jayaprakash Appajigol. I am consultant physician in KL's Dr. Prabhakar Kore Hospital. I am also a professor of medicine in Jain Medical College, Belgavi. Today, I want to tell you what is edema, how it is caused, why edema occurs, and what it denotes, how to diagnose this edema, means why this edema occurs and what are the different reasons and how to treat it. Okay, so first is what is pedal edema. Edema means whenever the water content of the body, like in the blood vessels, blood contains some amount of water. Isn't it? Once it has to be restricted to the blood vessels only. Once it's exudates, means comes out of the blood vessels, it gets collected into the interstitium, means between the cells, between the body cells. When this accumulation occurs, we can see swelling of the body. We call it as edema. Generally, edema occurs in the dependent parts, like somebody is walking around. Generally, swelling comes to the ankle region or feet region. The same thing, if patient is bedridden, like lying down, so we can see this swelling in the sacrum, we call, means back, the lower back, we can see this swelling. So how it occurs, why it occurs? This is due to the fluid leak, mainly the blood vessels or the capillaries are the smallest blood vessels which supply the blood to the cells. We call them as capillaries. Whenever there is a leak in these capillaries, for example, in case of dengue disease, we get capillary leak. In sepsis, we get capillary leak. Secondly, whenever there is a decreased protein in the blood, for example, in the liver disease, somebody is not eating properly and there is a malnourishment, protein is less in the body, or kidneys are losing the proteins. There also we get edema. That is because blood vessels cannot hold the fluid inside their vessels. So there will be extravasation or pushing of the fluid outside the blood vessels, and it causes accumulation of the fluid in the interstitium and causes edema. And whenever there is a stress or more pressure in the blood vessels, like in the capillaries, for example, heart has to pump the blood out of the heart and into the, and it has to take the fluid or the blood from the lower limbs. Okay, so when this heart functioning is affected, means heart is not functioning properly. Now what happens is, like, there will be more pressure inside the blood vessels because heart is not getting the blood and pushing it out. So accumulation of the fluid in a large quantity into the blood vessels, it causes pressure in the blood vessels, which causes again pushing of the fluid outside the blood vessels. By all these mechanisms, we can get increased fluid in the interstitium, or it can cause body swelling or edema. So what are the diseases? What diseases can cause this edema is the next question, right? So there are different diseases which can cause this edema. For example, disease of the liver, where because of the liver disease, liver is the site of production of proteins in the body. Whatever you eat, it gets converted into protein in the liver. So once there is a liver disease, protein in the blood will get decreased. So once protein in the blood gets decreased, so fluid cannot stay inside the blood vessels. It will get pushed outside the blood vessels, causing edema again. And disease of the heart, as I told, whenever there is a heart failure, heart is not functioning, so fluid in the blood vessels accumulates because it's not pumping out, and it is not getting the blood from lower limbs, and it is also not pumping out. So there is a more stress in the blood vessels. So once more stress in the blood vessels, fluid starts getting exudated or pushed out of the blood vessels. Likewise, uh, kidney disease. For example, in the kidney disease called as nephrotic syndrome, we call, where kidneys leak proteins. Kidneys leak proteins into urine. So more protein goes out of the blood vessel, blood into the urine. So there will be a protein loss. So once again protein loss is there, there is pushing, blood vessels cannot hold the fluid inside the blood vessels. Again, it causes edema or swelling of the body. So likewise, thyroid disease also can cause edema. There are some drugs or medicines, especially calcium channel blockers, we call. They are the BP medications. For example, nifedipine, amlodipine, cilidipine. These are also some of the medicines which also can cause edema. There are some medicines like steroids. They also cause edema by different mechanisms. So kidney disease is one of the important disease, which is life-threatening disease, which also can cause edema or swelling of the body. So what happens in kidney disease? Why we get edema? This is because kidney disease, there will be leakage of the proteins. There is leakage of the proteins from the kidneys. Kidneys cannot take back the protein, whatever is filtered into the kidney, and send it to the blood vessels. So there will be loss of protein through the urine. Once protein loss is there, we call it as oncotic pressure in the blood vessels reduced. So it means fluid in the blood vessels is pushed out of the blood vessels. So again, there is collection of the fluid in the body, which causes again edema. So now there are so many causes, as I told: liver disease, heart disease, kidney disease, thyroid disease, and medicines. All of them can cause edema. But how to know which is causing? For that, we depend on history, how edema has developed, and also some of the blood tests. Some of the blood tests are, for example, if we are suspecting kidney disease, we do urine analysis, urine examination, where proteins are leaking or not. We do liver function tests in the blood, whether liver is working properly or not. We can do blood tests of the proteins in the body, whether proteins are lost in the blood, in the urine, or liver is not synthesizing the proteins. We also do tests like ECG and echocardiography to find out whether heart has failed, which is causing edema. We can do blood tests for thyroid disease also. And we have to evaluate some of the drugs which patient may be taking. For example, very commonly is calcium channel blockers like amlodipine, nifedipine, which may also cause edema. So by all these means, we come to some conclusion that in this person, edema is because of this disease only. Especially chronic kidney disease or kidney failure is one of the life-threatening complication. Means it can, just edema can be a sign of chronic kidney disease. So one whoever is having edema, they should reach a doctor and find out what is the cause of it. Edema always means swelling of the body, always suggests some disease. It is not like just not like that. One of the other common medications like painkillers are also known to cause edema. So one should be careful to evaluate all these things. So once we diagnose the disease, for example, it is a kidney disease, or it is a heart disease, or it is a liver disease, then we need to treat the disease. How to treat the edema is treat the underlying disease. If liver disease is there, treat the liver disease. If heart failure is there, treat the heart failure. If albuminuria is there, treat the nephrotic syndrome, then edema comes down. Or that we use diuretics, means drugs which increases urine output. So urine will be more. So water accumulated in the body can be removed out of the body only through the urine. So we can increase the urine of the person by giving some drugs called as diuretic, say furosemide, okay, torsemide. These are some of the commonly used loop diuretics we call. They act on the kidneys to remove excess water in the body. So by that, they reduce the edema of the person. Along with that, doctors, we suggest to decrease the water intake in such persons. It depends on the person's water status, and we ask them to eat less sugar, less salt diet, less salt, low salt diet. These are also are going to help in reducing edema. So finally, edema suggests a underlying disease. Edema itself is not a, or a body swelling itself is not a disease. It suggests underlying disease. The disease may be very bad, like chronic renal failure, heart disease, kidney disease, liver disease. So whenever somebody has edema, has to approach a doctor, nearby doctor, and find out what is the cause for this body swelling. With that, once that is done, doctor assesses and finds out what is the cause. Then he treats it. So this is the information of edema or body swelling. Thank you.